Unlocking the Mind, a comparative analysis of Rational Emotive Behavior Therapy, RBT, and Psychodynamic Psychotherapy. Welcome to our YouTube channel, where today we will investigate the fascinating world of psychotherapy and explore the major differences between Rational Emotive Behavior Therapy, RBT, and Psychodynamic Psychotherapy. In this brief but to the point video, we'll break down these two prominent therapeutic approaches, shedding light on their unique philosophies and techniques, informing both psychotherapists and individuals interested in psychotherapy. Understanding Rational Emotive Behavior Therapy. Emotive behavior therapy, commonly referred to as RBT, is a widely recognized cognitive behavioral therapy developed by the renowned psychologist Albert Ellis in the 1950s. At its core, RBT operates on the fundamental belief that our thoughts, emotions, and behaviors are deeply interconnected. It posits that irrational beliefs and thought patterns can give rise to emotional distress and hinder personal growth. RBT is structured around a well-defined framework known as the ABCD model, which stands for activating event, belief, consequence, disputation, and new effect. In this model, the A signifies an external event or situation that triggers thoughts and emotions within an individual. The B represents the irrational or unhelpful beliefs that typically follow such an activating event. These irrational beliefs can be highly negative and self-defeating. The C denotes the emotional and behavioral consequences of these irrational beliefs, often resulting in distress, anxiety, or dysfunctional behavior. The core of RBT lies in the D, which involves disputing or challenging these irrational beliefs using rational thinking and evidence-based reasoning. Finally, the E indicates the new emotional and behavioral effects that emerge when irrational beliefs are replaced with rational, adaptive ones. One of the hallmark features of RBT is its strong emphasis on the identification and challenging of irrational beliefs to replace them with rational, adaptive thoughts. By doing so, individuals can learn how to regulate their emotions effectively and transform their emotional responses to external stimuli. This process enables individuals to take greater control over their emotional well-being, ultimately leading to more fulfilling and productive lives. RBT is renowned for its brief and goal-oriented approach to therapy. Compared to some other therapeutic modalities, RBT often requires fewer sessions to achieve meaningful progress. It is particularly well-suited for addressing specific issues, such as anxiety disorders, depression, and phobias. Clients and therapists collaborate closely to set clear, achievable goals, and the therapeutic process focuses on developing practical strategies for change, empowering individuals to overcome their challenges efficiently. Understanding Psychodynamic Psychotherapy. Psychodynamic Psychotherapy, a deeply rooted and historically significant therapeutic approach, traces its origins to the groundbreaking work of Sigmund Freud and his pioneering psychoanalytic theory. While it has evolved over time, psychodynamic psychotherapy maintains its foundation in Freudian principles and has expanded to encompass various psychodynamic theories developed by subsequent theorists. To understand psychodynamic psychotherapy fully, it's essential to consider its historical context. The approach emerged in the late 19th century as a response to the prevailing psychological theories of its time. At that juncture, Freud and his contemporaries were challenging conventional views of human behavior by considering the complexities of the unconscious mind. Freud's psychoanalytic theory laid the groundwork for psychodynamic psychotherapy and sparked a paradigm shift in psychology and mental health treatment. Psychodynamic psychotherapy places a profound emphasis on the role of the unconscious mind in shaping an individual's thoughts, emotions, and behaviors. This approach posits that a significant portion of human psychological activity occurs at an unconscious level, influencing our daily lives in ways we may not readily perceive. Psychodynamic therapists work with clients to explore these hidden aspects of the mind, aiming to uncover unresolved conflicts, repressed memories, and unconscious motivations. Moreover, Psychodynamic psychotherapy discusses the formative impact of childhood experiences on adult psychological well-being. Early relationships with caregivers and family dynamics are assumed to play a pivotal role in shaping an individual's psychological development. By examining these early experiences and the associated emotional attachments and traumas, psychodynamic therapists try to help clients gain insight into their present-day behaviors and emotions. This insight-oriented approach is designed to help individuals to address deep-seated issues and work toward healing and personal growth. Section 3. Fundamental differences. While both Rational Emotive Behavior Therapy, RBT, and Psychodynamic Psychotherapy are valuable therapeutic approaches, they differ significantly in several fundamental aspects. 1. Theoretical foundation. REBT is firmly grounded in cognitive behavioral principles. It centers on the notion that irrational beliefs lead to emotional distress and dysfunctional behaviors. RBT emphasizes the importance of rational thinking and the modification of irrational or unhelpful beliefs to achieve emotional well-being. Psychodynamic psychotherapy. Psychodynamic therapy traces its roots to Sigmund Freud's psychoanalytic theory. It focuses on the unconscious mind, early childhood experiences, and unresolved conflicts as the driving forces behind psychological distress and symptom formation. 2. Treatment goals. RBT is often solution-focused and goal-oriented. It aims to help individuals identify and challenge irrational beliefs, replace them with rational ones, and develop practical coping strategies. The primary goal is symptom substitution from dysfunctional to adaptive behavior and emotional regulation. Psychodynamic psychotherapy. Psychodynamic therapy seeks to uncover and explore deep-seated unconscious conflicts and patterns. While symptom relief is a goal, it also places a strong emphasis on gaining insight into one's inner workings, self-awareness, and personal growth. 3. Duration of treatment. RBT is known for its relatively brief and time-limited nature. Many clients experience significant improvement in a relatively short period, often ranging from a few weeks to several months. Psychodynamic psychotherapy. Psychodynamic therapy tends to be more long-term and open-ended. It can extend for several months or even years, depending on the complexity of the client's issues and the depth of insight desired. 4. Approach to emotional expression. RBT encourages clients to acknowledge and adopt a non-judgmental approach toward their emotions, while also focus on replacing dysfunctional beliefs that yield emotional distress and self-sabotaging behaviors with functional ones. The focus is on changing dysfunctional emotions, behaviors, and even physiological experiences. Psychodynamic psychotherapy. Psychodynamic therapy places a strong emphasis on exploring and understanding emotions as they emerge. Emotional expression and processing are essential components of therapy, facilitating self-discovery and emotional release. 5. Therapeutic Techniques. RBT employs techniques such as cognitive restructuring, disputing irrational beliefs, and homework assignments to help clients change thought patterns and behaviors. Psychodynamic psychotherapy. Psychodynamic therapy uses techniques like free association, dream analysis, transference interpretation, and exploration of defense mechanisms to delve into the unconscious mind and gain insight. Understanding these fundamental differences between RBT and psychodynamic psychotherapy can help both therapists and individuals seeking therapy make informed decisions about the most suitable approach for their unique needs and goals.